It's time now for our political panel with Evan Mulholland, the Director of Communications at the IPA, and Dr Richard Dennis, the Chief Economist at the Australia Institute. Thank you both for joining me. Richard, I'll start with you. There are more cases in New South Wales, in New South Wales and in Victoria today. How do you think the New South Wales government has handled the outbreak? Do you think they should have gone harder, faster in containing it?
Look, I think it's quite clear that from the medical advice point of view, the things that work in these situations are going hard, going early, and relying on masks. And 2 weeks into this now, we've finally seen the Deputy Premier step up and say masks are a big deal. But the government's missed the opportunity to go early. They've missed the opportunity to go hard. And of course, in an attempt to what they thought was protect the New South Wales economy, they've now imperiled the Victorian and the rest of the national economy. So, unfortunately, the longer this goes on, the more it looks like the coalition's approach to COVID resembles their approach to climate science, and that is, ignore the experts, don't rush in, and just kind of hope. And unfortunately, Victoria and others have shown, including the Liberals in South Australia, have shown how early action can save a lot of pain down the track.
Evan, you're in Victoria. What's your response to that? Is it the New South Wales government's fault that there are cases there now?
No, I mean, even if you accept that the restrictions and harsh rules that worked at 700 cases a day in Victoria were appropriate, the idea that we should apply the same rules for 8 cases a day is just intellectually confounding. The New South Wales government have done a brilliant job in managing the virus. They're actually the only state in the country that are following the National Cabinet strategy of suppression rather than elimination. An elimination strategy is impossible while you've got the doors open to international arrivals, even slightly jarred open through hotel quarantine as we do at the moment. And you've seen the same people like Norman Swan at the ABC, like other experts that called for lockdowns when things like the Crossroads Hotel outbreak happened, now calling for lockdowns in Greater Sydney when they've got around 8 cases a day. That's 8 cases out of 7.5 million people. You're more likely to win the lotto in New South Wales than catch the coronavirus. But people in New South Wales adjust to these things. They want to stay open. That's why the New South Wales government's approach is incredibly popular with the people of New South Wales. And it's also resulted in much more amount of testing than you've seen in any other state. They're able to get up to 70,000 tests a day. That's something the Victorian government haven't been able to do. And I think, in contrast, the Victorian government's approach has been just all over the place. They caused a rush to the border on New Year's Eve. People that have been really dying to get into New South Wales to visit family and they've been locked down all year were greeted with 6-hour queues at the border, which is just really heartbreaking for all those people. And the biggest lie from the Victorian government is that they warned people not to go to New South Wales, which is not true. They warned people about not going to Greater Sydney. Many people instead went to the South Coast or went to regional New South Wales for their holiday and were stuck on the border with this outrageous run to the border on New Year's Eve, which was just all over the place and disastrous. And the testing capability has just been not shown to work.
Yeah, a really rough start to 2021 for thousands of Victorians who are now stuck in New South Wales if they can't get back into Victoria. Richard, do you think it was fair to close the border with such little notice?
Oh, well, I guess we should have asked the virus to cut us some slack. Look, I mean, the problem is not about convenience, is it? Like, it's not about convenience. This is a very inconvenient virus. The question is, do we want to lock it down and fix it? Or, if Evan's happy with 8 cases a day, that's fascinating. But Queensland's not happy with 8 cases a day in Sydney, so people can't fly from Sydney to Queensland. South Australia and Tasmania aren't happy about it, so people can't move. So it's one thing to say you're more likely to win the lotto, but, a quick look overseas to the US or the UK, and we see how those odds deteriorate over time. So there's nothing convenient about any of this. There's nothing ironic about this happening at Christmas time. It's an outbreak, and it happened 2 weeks ago in Sydney, and it's not under control in Sydney. And at the moment, let's wind back the clock. Did Gladys Berejiklian allow the doorbuster sales to occur on Boxing Day? Yes. Did she put on fireworks and then tell people not to go and watch them? Yes. She about to host thousands of people at the cricket? Yes. But 2 weeks of ignoring advice about postponing events like that, 2 weeks, and she didn't want to tell people to wear a mask. So, yeah, it's terribly inconvenient. Evan's spot on, terribly inconvenient for those poor people down in Victoria. But this virus is not interested in our convenience. The question is, are we interested in the science of what it takes to stop it? And at the moment in New South Wales, no, we're sustaining it at 8 a day. Evan's happy about that. I don't know anyone else who is.
Richard, what about the testing rates though? New South Wales has proven that they can test up to 70,000 people a day. Victoria, they were turning people away at about 20,000. Surely they should have been more prepared.
Oh, perhaps they should, but, let's be clear. At the moment, Victoria seems to be testing more people than New South Wales does. Massive testing, wonderful, very helpful testing in the lead up to Christmas, but that's collapsed in Sydney in the last few days, and my read of yesterday's data was that Victoria tested more people in New South Wales. So New South Wales capacity might be greater than Victoria. I frankly know nothing about the relative ability of those two systems and how long they take to warm up. I don't know anything about it. But what I do know is that Victorians are rushing out to get tested, and that's great. But the New South Welshmen that were determined to get tested before Christmas seem to have lost their mojo there. And that, like the inability of the contact tracers to get ahead of it, means that we're likely to see this continue on all through January. And, if we want to talk irony, well, if we had a shutdown Christmas, New Year in New South Wales, that's the least disruptive time for the economy. It's terrible for families, but families are already being divided by this in New South Wales. We could have shut down hard during that period, but we're not. We're going to have everyone going back to work soon and getting on public transport. And anyone thinks that that's going to make it easier to contain, well, again, I'd suggest that have a look overseas and a quick look at what the health advice is. But, if Evan wants to ignore that advice, that's fine. It's a democracy. We get to make all the mistakes we want. Just ask Donald Trump.
Evan, masks are set to be mandatory in New South Wales for some indoor settings. What do you make of that decision?
Look, it's a decision that they didn't really need to make. I spent about half the year in Sydney during the Melbourne lockdown, and I wore a mask in supermarkets. I wore a mask in indoor settings, in public places and on public transport. And you'll find that 95% of people also are wearing masks as well, because of the goodwill of the people of New South Wales to come together and follow the advice. The advice was that masks are highly recommended in those settings. We shouldn't have to use blunt forces like fines in order to compel people to do things like wear a mask. We can rely on the goodwill and common sense of people to make their own judgments about that. And we've seen in Victoria, in particular through commendable reporting in The Guardian, that the fines in Victoria are more than any other state combined, and were often put upon some of the most vulnerable people in our community, some of the most low socioeconomic people in our community that just don't have the ability to pay those. So I think we should use our common sense with this. And I think if they're going to make masks mandatory, the police and authorities should also use their common sense in people's ability to either get a mask or be in the appropriate scenarios while wearing them. But I don't think it was really necessary. The people of New South Wales have really rallied together, and you go to a supermarket, you go to a public transport, and 95% of people are using them. So I don't think it really was necessary in the first place.
We're almost out of time, but just quickly, Richard, the vaccine will be rolled out this year. Do you think employers should have the right to make their workers get the jab?
It's hilarious, isn't it? I mean, Evan's worried about governments forcing people to wear masks, but in Australia we're far more likely to have employers forcing people to have vaccines. So, I think that a lot of employers are going to encourage that, and the law seems to give them that power. Employers have a lot of power over employees in Australia, something that probably makes Evan pretty happy. But yeah, the reality is we're talking about voluntary masks and compulsory vaccination. It's a strange version of liberalism we have in Australia.
Evan, really quickly, what's your reply?
Yeah, I think Richard's probably right that employers do have the right to do that. Whether it is right for them to do that, that's up to them to explain. I think the way you build trust is not forcing people to do things like take a vaccine. The way you build trust is a competent rollout of the vaccine, and that's what Australians are looking to the federal government and other organisations that are part of the vaccine rollout to do, is just be competent in rolling it out, and that will build trust in the community to take it.